Hello everyone, I am Justin Brown. I am a physical therapist at Advanced Physical Therapy Center, and today I'm going to be going over biomechanical faults of throwing mechanics in baseball pitchers. There are 6 primary phases of overhead throwing motion. It's the wind-up, stride, cocking, acceleration, deceleration, and follow-through. But the primary motion phase we're going to be looking at is the stride phase, as this is the area that a majority of findings stem from. Now the stride phase starts at knee up, which is where this video is paused at here, and it ends with foot contact. You have 2 primary views you want to look at, the side view and the behind view. This here is our initial side view, and there's several things you want to look at in this view. You want to look at the stride length, shoulder abduction, elbow flexion, lead arm and lead knee positions, and the posterior trunk tilt. So the first thing that we'll assess is let's look at the stride length. Now, a great way to go about this in your setting is if you just measure the height of the person that you have pitching, then lay it straight out from where they're pitching at, mark several marks at 50%, 75%, and 100%. It helps you have an idea of how far they're striding out. So if we take this here, and then we take a estimate out about through here, then we have that him start going through the motion, striding out. We see that looks to be about 3/4 of the way of that line. So it's pretty close to about a 75% stride length. Now, when you're on a mound, you should be between 73 to 90% of the body height. But when you're on the flat ground, you're expecting it to be slightly less. So on here, we'd expect it to be about slightly less than what they would on a mound. So 75% here isn't too bad because he may have a longer stride length when he's on a mound. Now, overstriding can cause an unstable landing or loss of trunk control, and understride underutilizes the power of the lower extremities. Let's go back and look at our shoulder abduction. We'll clear off this portion here. So our shoulder abduction we're going to look at this point here. So what we want to look at is this through here. How high up that shoulder is. So as we can see, it's a bit more than 100 degrees. It's about 110 degrees. And if you look at it, it looks like his arm is a bit high with it. So you can see that the throwing arm is higher than 100 degrees. Ideally, we like to bring that arm down a little bit with it. So the deviation increases the elbow varus torque. That varus torque is that force on the inside of the elbow. All those patients we hear about having the Tommy John surgery, this is the area that it puts the increased torque at, causing the MCL to fail, which is that ligament that gets the surgery with the Tommy John surgery. So now if we have decreased abduction, you will see a dropped or low shoulder. We don't see increased abduction often, so this is a little bit high with it. So this is a little bit more unique because the arms up high. It is something that could possibly work with them if you bring it just a little bit down with it. So our next one we're going to look at is elbow flexion, which we can look at in this here. Now we can see if I can get the angles good. The elbow angle here is about around 120 degrees. And if by eye shading you're looking to say it looks like his arm's a little bit more straight than what you would typically expect. So this is where we'd also want the elbow to become a little bit more straight or a little bit more bent with it, so that way you have that closer to that 90-degree angle. So now, decreased elbow flexion increases that shoulder distraction forces, but increased flexion leads to increased elbow valgus force, which is akin to that issue with the Tommy John surgery, the MCL. So when you see decreased elbow flexion, it will appear as the elbow is out straight or reaching back. Increased elbow flexion will appear like the head is to the ear. So now this one here looks like the elbow is out straight, or is that reaching back portion with it. So now let's look at our lead arm position and lead knee position. Now we can see that lead arm, that hand is pointing straight out, so we have a good lead arm position, and lead knee position. We want it to be about 38 to 55 degrees of knee flexion. So let's look at this here. So now we see that we are a bit more flexed than what we would like to have here. So there's 2 different ways you can go about this. You can look at it this way, and look at it a bit this way. So if we take it about this way, we're not too bad off that, but it's a little bit more bend than what we would like. We're at about 103 degrees in knee bend. We'd like that to be a little bit straighter with it. Just a little bit more than what we like to see with it. And then we want to look at a posterior trunk tilt. So that trunk tilt is seeing if these shoulders here are straight, which by the eye they look to be pretty straight there. So these are the main things that we're going to look at when we're looking at the side view of the throwing mechanics through the stride motion.